Welcome to Conversations on Healthcare. This week we welcome Pulitzer Prize-winning science writer for The Atlantic, Ed Yong, on the grim milestone of 1 million American deaths from COVID, many of them preventable. Now, here are your hosts, Mark Masselli and Margaret Flinter.
The 2021 Pulitzer Prize Board said that our guest reporting was a, quote, series of lucid, definitive pieces on the COVID-19 pandemic that anticipated the course of the disease, synthesized the complex challenges the country faced, illuminated the U.S. government's failure, and provided clear and accessible context for the scientific and human challenges it posed.
Ed Yong is a staff writer for The Atlantic and also a book author. Most importantly, he's been an independent guide for all of us during this pandemic. His story, titled How the Pandemic Will End, is one of the most read pieces in The Atlantic's history.
Well, thank you so much for joining us, Ed. But before we get to COVID, let's just start out with the news about the Supreme Court draft that apparently will result in each state's needing to decide if abortions are legal. You've said that you focus in on how science is engaging with the realm of politics, policy, and real patients. I'm wondering what perspective and insights you can bring to the abortion story at this time. Is this all a legal argument, or should health and science concerns be more at the forefront?
Look, I'm just going to say that abortion is healthcare. I think the ethics were very clear here, and I'm not going to say any more about it because I've not reported on it. I think the pandemic has been characterized by a lot of people straying well outside their realms of expertise, and unless I've actually done the work, I'm not going to opine on something that I'm not intimately familiar with.
That's great.
Great. Well, then let's turn to COVID. We've heard the grim news, the latest estimates showing 1 million Americans have died from this virus. And I think we all sense that so many deaths could have been prevented. We're at a point now where roughly 30% of Americans are likely never to be fully vaccinated. And even in our own organization, our data shows that while we're pretty successful with our communities our patients getting to about 66% for completing the primary series, only 26% are returning for the booster. From your vantage point, is this one of the most surprising parts of the COVID story, that even in the presence of readily available vaccines, we're seeing this difficulty getting people to get the boosters?
I don't think it's even slightly surprising. I think if you look at attitudes around vaccinations that long preceded COVID, you could very easily see all the seeds for what we're currently seeing now. And I think that it is neither surprising that much of the US decided not to get vaccinated despite the efficacy of the vaccines, nor is it surprising that many people in the biomedical establishment were surprised by this. I think that we as a country have long had a very technocratic mindset towards health problems. Like, we have sought solutions to large social problems through the fruits of the biomedical research enterprise. And while those things are undoubtedly fantastic and incredibly useful, they also have limitations. Like, the problem here is that a vaccine is a product. And being a very tech-focused nation, we assume that once we got the product, we would fix the problem. But the vaccine is useless without vaccination, and vaccination is a system, and the US is riddled with broken, inefficient systems. So vaccine delivery and access depends on things like whether people have vaccination sites near them. It depends on whether people have the time and the capacity in their lives to make an appointment. Things like even the most recalcitrant anti-vaccine attitudes have the social dimension to them. They come down to things like trust in each other, trust in the government, and both types of trust are sorely lacking in the US. I think in part because, well, as Ariana Marie Planey put it to me, you can't expect people to buy into an intervention like this if they just don't believe that the government has their backs. Like, if they, it's a terrible paraphrase of her actual quote, but I think the point remains. If you have a society where people don't feel that people in power have their interests at heart, then of course you're going to breed distrust. And of course, in a situation like this, where where people in positions of power now are saying, do this thing, a lot of people are going to go, well, why? Like, why this thing and not all the other things that would have made our lives better that haven't been rolled out before now? So no, I think that the problems that we've seen in vaccine uptake are very much a part of all the other problems that have cost the US response so dearly. And I hope it's a chance for the medical establishment to have a bit of a wake-up call and think about how it's thinking about how to solve these very large, difficult problems.
4 years ago, you wrote an incredible article with the headline, "The Next Plague is Coming, Is America Ready?" And it's literally a terrifying read, how much you accurately nailed down what was ahead of us. Here's a direct quote from that 2018 article. "The White House is now home to a president who is neither calm nor science-minded. We should not underestimate what that may mean if risk becomes reality." I'm wondering if your reporting shows how different political leadership could have saved lives in 2020.
I think it's very clear that having a president who was, actively downplaying the pandemic, who was hyping up false miracle cures, all the rest of it, really didn't help matters. There is a very interesting question to be asked about whether if we had a different president, someone more science-minded, let's say if Biden was president at the start of the pandemic, would things have been better? And honestly, I'm not sure the answer is yes. I look at how things have progressed over the last year and a half, despite, as you say, as you both have noted, vaccines being available, a new, supposedly more science-minded presidency in place. And yet we have still been beset by wave after wave. We still seem to be making the same mistakes again. More people have died since then than in the preceding phase of the pandemic. And I think, again, that should force us to question some of our assumptions. I'm not saying that, that the Trump presidency was blameless, but I also think that people who are pointing to it and it alone as the reason why the US has failed so badly, I just feel like how does one get a mattress that is so comfortable that one can fall asleep for 1.5 years, right? Like, we've had, I think that in some ways, the theatrical incompetence of the Trump presidency makes it very easy to think that's the sole problem, and it distracts from the more banal forms of incompetence that we have seen since. Both administrations have gone very hard on this very individualistic stance on the pandemic. This idea that we're going to, as I've said already, use biomedical countermeasures, pharmaceutical interventions to get our way out of this without having to put in the work of building up the social support and the other kinds of measures, things like masking, ventilations, testing, all the rest, that would protect the health of the population at large. Both have failed in their own specific ways to really shore up public health at a time we really need it. And I think that, again, Trump was deeply problematic and wrong in his approach to the pandemic. But I think if the only lesson we learned from these 2+ years is it was all on Trump, I think we have absolutely learned the wrong lesson. As Greg Gonzalez told me, the problem, the problem was in the rootstock. The problems are foundational and long-standing and fundamental.
Well, that is a really interesting perspective. And I'd like to then move on to talk about your article on how the pandemic will end. I'm almost reluctant to use the words will end, but presumably it will at some point. But Dr. Fauci says the acute phase of the pandemic is over. But Dr. Deborah Birx told us pretty recently that we can expect more variant surges will continue to occur. What's your reporting telling you about what's likely to happen?
I think by now it should, I think everyone who's been reporting on this knows that predicting even the near-term future of the pandemic is very difficult. I've just been interviewing healthcare workers today across the country, and they really range the gamut from, in my state, everything looks fine in my hospital, and we are cautiously optimistic to, in some places, we are nearing the way things were at the height of the Omicron surge in terms of new admissions. So things are varied and things are going to be difficult to predict. What I think I want to stress, much more than saying what's going to happen in the near-term future, is that I think that we, as a society, and certainly in my profession of journalism, have this tendency to be very laser focused on the present. We want to know what is happening right now. And that tendency blinds us to, I think, one of the biggest and most difficult aspects of the pandemic, which is that its toll is cumulative. The story isn't what is happening right now. The story is what has happened altogether over the last 2.5 years. And if you look at that, you'll see that certain groups have been disproportionately impacted by what has happened. So healthcare workers are one very obvious one. The people I've talked to have been pummeled by relentless surges and have been repeatedly traumatized by the horrors of what they've seen in a way that isn't just going to go over, even if, as Fauci claims, the acute phase of the pandemic may or may not be over. I'm a bit skeptical about that, but even if that's true, we're not grappling with everything that's happened before that point. So long haulers are another group that have borne the disproportionate and long-term consequences of 2+ years of failing to control COVID. Many of them, some huge number of them, are still grappling with long-term symptoms. Many of them have recently experienced the 2-year anniversary of symptoms. I've written pieces about people who are grieving their loved ones. By some estimates, 9 million plus Americans who lost someone very close to them to COVID. Many of the people, including those who lost people in the very early phases of the pandemic, are still grieving, are still hurt, because they haven't had any of the conditions that allow people to process their grief. They haven't had rituals of collective mourning. They've been constantly bombarded by insensitive questions from the people around them. And it's almost like they had to lock their grief in a time capsule, which is now reopening as much as society has decided to itself reopen. They feel raging and sorrowful all over again. So, I am concentrating my reporting right now on the groups of people for whom the pandemic very much isn't over. Immunocompromised people are another group in like this. And I think that the question that many people have posed throughout the pandemic has been, when is it over? When is it going to end? And I think for a long time now, the real and most important question has been, who has to bear the risk that remains, and what can we do to protect and care for them? That's how I'm thinking about the future.
Mm-hmm. I want to pick up on the phrase you used, sort of the storytelling part of the role that journalists play. And in this, we live in a free society, so there's a lot of different voices out there. And I'm wondering, as a journalist, how do you answer critics who say the media have filled the country with so much anxiety and worry that they've turned off readers and viewers, that maybe in some ways reporters have cried wolf too often, or at least there's that voice out there that has caused confusion in so many people's minds?
My duty as a reporter is to be honest and fair. And if things are bad, I'm going to tell people that things are bad. If things are good, I'm going to say that things are good. But the problem is that the pandemic is multifaceted. Things have been bad for a long time. And just to be very clear, the fact that things have been bad for a long time doesn't mean that we suddenly throw our hands up in the air and say things are good now because we're tired. I think that's actually where a lot of people have got to. And I think that a failure of our, I think it represents a failure in our duty as a profession, as truth tellers. We should also be holding power to account. Like this very, very time-worn phrase in journalism is that it's about comforting the afflicted and afflicting the comfortable. And I think that actually we've done the opposite of those two things as a field for the last 1.5 years. I think journalists were among the people who got easiest and earliest access to vaccinations. And many people simply decided that the pandemic was over and that it was safe because they themselves were safe. think this was abundantly clear throughout the last year. It became especially clear in the Omicron surge. And it continues to be a problem now. Like, rather than focusing our attention on the groups of people who are most likely, who have been most harmed and disproportionately impacted by the pandemic, we're sort of privileging people who are in the wealthiest, safest, most secure positions. And this sort of ties back to my early answers about the pros and cons of medical interventions, right? The problem here is that epidemics and medical interventions flow in opposite directions. The epidemics flow downwards into society's cracks, taking out the most marginalized people along different axes. Medical interventions flow upwards into society's penthouses. They are accessed easiest and earliest by people with privilege, wealth, money, connections, and power. Those people then decide the thing is over and they move on. And this problem was identified by folks like Bruce Link and Joe Phelan decades ago. In their theory of fundamental causes, they talked about this as a factor behind the ongoing and persistent inequalities in health in the country, even though the specific pathogen of the day might change, or even though medical progress is ostensibly made. Why are the same disparities persistent? Why are the same people suffering over and over again, whether it's with polio or HIV or now COVID? It's because of this dynamic. And I think that we in the media are complicit in that, and we should try and push against it.
Well, Ed, we've also read your tough reporting about the public health field, and note your writing that public health, in your words, willingly silenced its own political voice through the years. But public health stakeholders are speaking out at all levels now about racism, equity, and climate change. Are you seeing significant signs of a change? Is that generational, or is the field just grappled with its necessity to speak out on these issues?
I'm seeing both. So the argument in that piece is that there was a time in the sort of early 20th century when public health had this more of an understanding of the social dimensions of disease, the idea that things like poverty and inequality and lack of education, poor housing, poor sanitation, all the rest were profoundly influenced which communities got sick and which didn't. And that the sort of biomedical model, the idea of disease solely as a battle between host and pathogens, pushed people away from that style of thinking, and it also led the field to be less political, less socially minded, less focused on action and fixing these large community-wide problems, and instead, hewing to this medical model of looking down a microscope and finding a way of annihilating the bug in question. That has been the case, I think, for many decades in the early 20th century. It began changing certainly in the late 20th. There's the rise of social epidemiology, the understanding of the social determinants of health. As you say, over the course of the pandemic, we have people from across the public health sphere really grappling with the effects of racism on public health, the idea of racism as a public health crisis. But I think that transition is nowhere near complete. I'm not even sure that view is even in the mainstream. Certainly, I feel that the majority of public health voices I talk to and have interviewed understand this very deeply. But there are certainly many prominent voices who I feel don't, and who have promoted this very, very individualistic way of thinking about the pandemic that is contrary to the very tenets of public health. This idea that coping with the pandemic is now a matter of individual responsibility, that the right way of analyzing what to do right now is through the frame of one's own individual risk. I think this is antithetical to public health for at least two reasons. Firstly, the field should be about the health of the population. It's not just, it's about the health of the collective, and especially in the case of a pandemic, when individual risk only gets us so far. My health is profoundly influenced by the choices of the people around me, but also my circumstances constrain my choices. I lead a very privileged life, and I have the option of doing a lot of things to protect myself. People from low-income groups and marginalized groups don't have the same luxuries. And public health should be focused on them. They should be focused on the people who have the highest risk of infection and long-term disability and death, the people who have the least options for accessing vaccines or treatments or protecting themselves. And I actually think that a lot of leaders in this space, a lot of the most prominent voices who get the chance to write op-eds in big newspapers and magazines, have done the opposite. They've sort of privileged that much more, privileged the privilege. They've thought about the pandemic really through this very individualistic mindset that I think seems to be contrary to the ethos of the entire field. So a very long way of saying yes and no. I think there's still a lot of room to change for the better and to recapture some of that deeper, more political, more socially minded ethos that animated the field in its earlier days.
Mm-hmm. You know, I couldn't agree with you more. The work that we do in our daily life is providing healthcare to underserved populations, not only here in Connecticut, but across the country. And I think this notion of the collective is so important. Our marginalized populations are just ignored. How do you see that translating? Seems to me that the public health system has somewhat been eviscerated prior to the pandemic. How do you see that change of philosophy translating into public policy? Who will be the gatekeepers or the initiators of that change to a broader, more comprehensive view of public health and its responsibilities?
Yeah. So, right, and I think this is the big challenge for the field right now. You know, the public health historians I've talked to have made this argument, which I think is very solid, that the field, in sort of shifting towards this this sort of biomedical paradigm, in abandoning like it kind of social roots, also like narrowed itself, right? So it abandoned alliances that animated in the early 20th century, and it contributed to its own marginalization. But that once those events are set into place, it's very hard to right the ship. You know, public health has famously been underfunded for the better part of a century, and continues to be, despite everything we've seen in the pandemic. So how are a group of people who don't have enough funding, who are now being sort of harassed and vilified, and who are working under the most difficult of conditions, meant to tackle problems as vast as racial inequality, as poverty? You know, it's surely beyond the mandate of public health to even think about these problems, and yet it very much is within their mandate, right? Because as we've said, like, these problems are public health problems. We're not going to get to a better situation with the next pandemic without fixing them. So what do we do? I think that the thing that gives me the most hope is seeing the rise of a lot of grassroots activist groups, people who are fiercely campaigning for change in public health, in healthcare, in all the rest. You know, I think that public health, as it currently defines itself, cannot do this problem alone, but it doesn't have to do this problem alone, because there are other folks from all different aspects of society who are also doing that kind of work, and who might not even think of themselves as working in public health, like housing advocates. I have seen so many groups who've cropped up in the specific communities that I talked about earlier, in communities of grievers, in communities of long haulers, in immunocompromised communities, people who have said enough, like, we are not going to let ourselves be ignored and neglected and marginalized any further. And I think there's power in that. And I think there's especially power when those groups start to link up with each other, as I see them currently doing. I think that can be a tremendous force, because the pandemic has been so far-reaching. That's part of its tragedy, but I think that's part of the current opportunity, where the groups of people who have been disproportionately affected are so vast in number that they could have a very strong presence in advocacy and in shaping our collective future moving forward. So I think it's hard to be too optimistic about it, right? You know, we've seen a lot of moves that I think will make us much less prepared for the next pandemic than for this one. We still are lapsing into the next. We talked about the panic neglect cycle a lot. This idea that once a crisis hits, everyone freaks out because they're underprepared. But then once things get better, attention and investments are pulled away. We didn't even have to wait for the thing to be over this time, right? We have cascaded through multiple cycles of neglect, even while the pandemic has been in its acute phase. But I think that there are large groups of people who refuse to let us neglect, who refuse to let the lessons of the last few years be forgotten. And I think that the question now to me is, do those groups have sufficient energy and power and resilience to keep that going into something, or are we just going to lapse into the same level of unpreparedness and failure that we were in at the start of 2020?
Well, Ed, I think I certainly have the same view about the rise of grassroots activism, and we skew towards the optimistic and certainly hope that will be sustained. And if people needed a reminder about why we need to sustain this kind of energy, you've written that new research shows that climate-driven animal migrations are likely to make pandemics more likely in the future. Maybe just share with our listeners, why is this so, and fill us in on what is called, and apologies if I mispronounce this, the Pandemicine.
To be clear, the Pandemicine is a word that I made up to describe
neologizing as well.
Yes. This story was about a study conducted by Colin Carlson, Greg Albury, and others who have been thinking about the ways in which climate change is going to affect our risk of pandemics. And the mechanism they're thinking about is actually pretty straightforward. So as the world warms, animals are going to be forced to relocate to new habitats to track the environments that they are best adapted to. As this happens, species that never previously coexisted will suddenly encounter each other for the first time, creating opportunities for their distinct groups of viruses to jump into new hosts and eventually into us. Their study, which simulates these events over the next several decades, shows that they are going to happen to an extreme degree, that they are going to happen, that these kinds of spillovers will happen disproportionately in the areas where humans are likely to inhabit, which is bad news for us. And I think worst of all, that they have already been going on, that this process is well underway, and we're sort of in the peak era of these new first encounters and new animal-to-animal spillovers. And climate change, and because we already live in a world that's 1.2 degrees warmer than pre-industrial levels, that's plenty warm enough for this to happen. Even if from now on we curb all carbon emissions moving forward, we still have to cope with the consequences of what we have unleashed and what is going to happen in the near-term future. This era of increased spillovers, this pandemicine, as I've called it, once unleashed, cannot be rebottled. We now have to learn to cope with it. And I think, in the context of everything we've said, what this means is that everything we've gone through over the last 2.5 years will happen again. It just will. I think there's this sort of feeling and hope that this is a once-in-a-generation event. And I would certainly love it if that was the case. But I think it will happen again. I think it will likely happen again within my lifetime. I think given the way things have been going, I think we will see at least one new emerging or re-emerging disease within the next few years. And we have to be prepared for it. Now, typically in the way people think of pandemic prevention, in like that 2018 piece that talked about whether that I wrote about whether America's prepared, we talk about things like surveillance systems. We talk about things like preparing vaccines for the most likely dangerous pathogens ahead of time. We absolutely need to do all of those things, and those things are important. But there is no way of getting the risk of spillover and the risk of future pandemics down to zero, which means that we must be ready to intercept and deal with new pathogens when they arise. And that means that we need to fix those social problems that I've talked about, the ones that cost so many people dearly this pandemic, and the ones that are going to cost us so dearly in the next one. I said repeatedly that normal led to this. So we need a different, better normal.
Ed, speaking of things that you wrote, you have a book coming out in June titled An Immense World, How Animal Senses Reveal the Hidden Realms Around Us. I wonder if you could just share a little bit about that. I know our readers who follow you religiously would be interested in getting a little preview.
Sure. Just switching gears and tone completely. The book, so An Immense World is about how other animals sense the world around them. And it's about how each species, humans included, only perceive a very thin sliver of all there is to perceive. So other creatures see different colors than we do. They detect movements in water that we can't feel. They detect electric and magnetic fields that we can't sense. And what this means is thinking about the senses of other animals allows us to perceive things that might be familiar and everyday to us in a radically new and kind of magical way. When I go for a walk with my dog, I'm constantly enthralled by what he perceives on the street, like the things he smells
right.
in areas that just seem like, the same streets that I've walked on hundreds of times before. I think that I hope that for people who read it, the book is a source of joy and wonder at a time when much of our lives have been dominated by darkness and sadness. These are rough times, and I'm not going to pretend that reading my book is going to fix any of the vast systemic and social problems that we've discussed here. But I hope that it gives people a little, shot of warmth into their soul. At a time when I think that we all need a bit of that right now.
Thank you, Ed. They say that journalism is the first draft of history, and you have so vividly captured this very challenging period. And thank you to our audience for joining us. You can learn more about Conversations on Healthcare. You can sign up for our updates at www.chcradio.com. Ed, thank you so much for your writing and for joining us today.
Yeah.
Thanks, Doug.
Really appreciate it. Thank you. Continued success. We look forward to continuing to write. And I'm looking forward to that book, actually. It's sort of this polymorphous, perverse stage that we don't realize the animals have all of these other abilities that we're simply lacking.
Yeah. Mark and I are both early morning walkers. It sounds like you're a walker as well. And this time of year, at least on the East Coast, I'm not sure where we're finding you, when spring is bursting out all over, the bird song is overwhelming, the water, the plants, everything is really a joyous time to be alive, and certainly always makes us think about what climate change has in store for us in terms of other consequences.
That after reading the book, you'll see all of those things: the bird song, certainly the water, certainly the plants, in a new and interesting way. Thank you so much for having me on, folks. I appreciate it. Take care of yourselves. Good luck with everything.
All right. Thanks so much. Ciao.
Bye.
Bye.